Welcome to the Drive Medical Pure Oxygen Concentrator training video. This video is intended to supplement the product user and service manuals and should not be considered a replacement for those documents. The Pure O2 is a 5-liter stationary oxygen concentrator, proudly assembled in Drive Medical's state-of-the-art respiratory research, development, and testing facility in South Florida. The Pure O2 stands 24 inches from the ground, with a width of 17 inches, a depth of 10 inches, and weighs just 35 pounds. The integrated handle and easy roll casters make the Pure O2 simple and easy to move. The Pure O2 comes in 2 different models, the CH5000S, which senses oxygen purity, and the CH5000, which does not sense oxygen purity. Both units will produce oxygen purity between 87 and 96%. Let's take a closer look at the Pure O2. The top of the unit has a convenient integrated handle for carrying and moving. The front of the unit includes the power switch, LED indicator lights, the flow meter knob, the flow meter, the oxygen barb outlet which connects to the oxygen cannula tubing, and the hour meter. The Pure O2 is turned on by switching the power button to the on position. An audible tweet will be heard, and the LED lights will cycle through green, yellow, and red. Then the green LED will blink for approximately 6 to 10 minutes during startup and finally become solid, indicating normal operation and oxygen purity levels. The LED indicator lights and alarms function differently between the 2 units. Refer to the user manual for detailed instructions for both models. When operating the CH5000S, note that the green light indicates normal operation and oxygen purity levels. The yellow light indicates a warning with below normal purity levels. The red light indicates that service is required. Refer to the product manual for instructions on how to troubleshoot this alarm. If the alarm cannot be cleared or if you have further questions, please contact Drive Medical for further troubleshooting assistance. The flow meter knob is used to adjust the liters per minute, or LPM output, to the prescribed setting, from 0.5 to 5 LPM. The ball inside the flow meter will indicate the LPM setting. Counterclockwise will increase the flow, clockwise will decrease the flow. The Pure O2 hour meter is located on the front of the unit and tracks the hours the concentrator has been running. This is for service personnel to gauge when periodic and routine maintenance is required. On the back of the unit, below the integrated handle, is an elastic cord and humidifier bottle holder for instances when the patient requires humidification. Secure the bottle in the holder with the elastic cord. Then, connect the bottle to the oxygen barb outlet with the humidifier tubing. To the right of the humidifier bottle holder is the filter door, containing the washable foam pre-filter and user-replaceable HEPA filter. It's recommended to periodically wash the foam pre-filter as needed in warm water and mild detergent. Be sure to thoroughly dry the filter before replacing. The HEPA filter is not washable and replacement is recommended every 12 months or as needed. Replacement filters may be purchased from Drive Medical. The Pure O2 serial number label with production identification, manufacturer, warning, and regulatory information is located on the back exterior panel of the concentrator. To the left of this label, you'll notice a transfill port. The polarized power cord is located at the bottom of the unit. Always plug the unit directly into the wall outlet. Do not use extension cords. Now, let's take a look inside the Pure O2. The main components of the Pure O2 are the PC board, the compressor box, and the sieve bed module. The PC board is the brain of the Pure O2, housing software which runs the oxygen sensor, compressor, solenoid valves, and converts data signals into user-readable information via the LED indicator lights, audible alarms, and the hour meter. The compressor box houses the Thomas compressor, the heart of the Pure O2, mounted on springs to reduce noise and vibrations, and a cooling fan mounted on the side to circulate air past the compressor and out of the unit in order to keep the compressor cool, extending the life of the compressor. The sieve bed module is the lung of the Pure O2. This module contains 2 sieve beds where the oxygen is produced, the accumulator tank where the oxygen is stored, and the Bosch valve for efficient operation. As the compressor pulls in room air, it will push it to one of the 2 sieve beds. As air passes through the sieve, nitrogen is trapped, leaving highly concentrated oxygen, which gets passed to the accumulator and then to the patient. As pressure builds in one sieve, the time pressure sequencing and valve system transfers air input to the other sieve bed to create concentrated oxygen. As this occurs, excess oxygen is flushed through the previous sieve bed, pulling out the nitrogen and preparing it for use. Drive Medical has designed and manufactured the Pure O2 with serviceability, reliability, and aesthetics in mind. Please contact your Drive Medical Territory Business Manager or contact Drive Medical directly with any further questions. Thank you for taking the time to learn more about the Drive Medical Pure Oxygen Concentrator.